Hey guys, this is Mitch Weissung from Bruiserbulldogs, and with me here today is Root Beer. Root Beer is a 10-week-old puppy, English Bulldog puppy that we're really excited about. But today, Root Beer is going to be my assistant. And actually, we are talking about a subject that is very dear to my heart. We are talking about upper respiratory infections. And before we talk about that, I really want to set the framework of how we need to understand upper respiratory infections or URIs with English Bulldogs, because it's very different. The uniqueness of the English Bulldog makes an upper respiratory infection incredibly different than any other breed of dog out there. The starting point when we understand English Bulldogs is you have to understand them that they are incredibly unique. That uniqueness starts, as we know, English Bulldogs are a brachycephalic breed. And what that basically means is their nose oftentimes is a little bit shorter, their air passageways are a little bit narrower, their nostrils a little bit tighter. All those things are characteristics that will prohibit functional breathing. As you guys know, one of the things that we strive for at Bruiserbulldogs is to breed a healthier bulldog that breathes better. And basically what we have done in our bloodlines is a bulldog that's a little bit lighter in the wrinkle set, that has better holes to breathe out. They're better nostrils, better trach, bring out the elongated soft palate. So those are some things that we do to alleviate the problem, but it doesn't get you away from the reality that the English Bulldog is unique in its breathing ability. And this dramatically affects the way we look at upper respiratory infections, the way we treat them, and the way we care for an English Bulldog that has a URI. And really, a lot of times the URI is most problematic at a certain time frame. And so we call the really danger zone for a Bulldog puppy from that 6 to 10 week range. And that's one of the reasons why we actually do not allow any of our Bulldogs to go home before 10 weeks. We want that risk period to be under our care because we have 15 years of experience dealing with URIs, and we see that sometimes the care of a URI is problematic when they go home to an adopter. And so that is why I'm making this video today, to help educate us what a URI looks like, what do we do after we diagnose URI, when we see those symptoms, and how do we successfully move towards recovery. So the first thing I want to talk about is what do we look for in our Bulldogs? What kind of symptoms do we look for to diagnose a URI? And so we get that call quite often from adopters. Just a question of, does my Bulldog have a URI? I think they're sick and things like that. And so I want to go kind of a step-by-step process of how we are able to diagnose a Bulldog and kind of go through the steps of the symptoms of a URI. So the first question that we need to answer is, what are the stages of a URI? And so I've kind of broken them down into the beginning stage, the middle, and the ending. And so some of the symptoms that you will see in a Bulldog in the beginning stage of a URI. So this means they might be catching a URI. And so as humans, we would know that we were catching a cold or something like that. And that's very similar to an English Bulldog, where there's a process of a couple days that you're going to see beginning symptoms. And so some of those things that we see that are signaling to us that your puppy might be getting an upper respiratory is first, a clear discharge and sneezing. And so if you see your puppy sneezing a lot and have some watery discharge, those are some of the things that you start to be mindful of, that there might be something going on. And so you see the first beginning stages are that clear discharge, a little bit of sneezing, and then it will progress into some different symptoms. And so what you, as the next couple days progress, you're gonna start to see a little bit of coughing. You're going to see, and at first it starts as more of a dry cough where they're not getting anything out. And so you just hear a little bit of a hack. And then there's a progression in the mucus. So where we had at the beginning a clear discharge, that discharge then progresses into more of a mucousy discharge. And as that progression occurs, then you're going to start to hear more of a hack that is wet, like a wet hack, where they're actually coughing phlegm up and things like that. And so a lot of times we'll get a call in between those first and second stage. And the first thing that I want to know is, and this is a huge indicator, what type of cough is it, right? And so I would much rather hear a violent, hacky cough where we're producing phlegm. That's actually a good thing, because we know exactly where that dog is at in those stages of upper respiratory if we hear that. We know they're at the middle to the end of the upper respiratory if they're producing phlegm out of their cough. Where we question that stage is if you have a puppy that is coughing but not producing phlegm. And so we said one of the indicators early on is a dry cough that's not producing, that's not wet. But also, so we have that indicator or symptom at the beginning of an upper respiratory, but we also have a very similar cough that can occur at the very end, or if the URI progresses into a pneumonia state, and that becomes a cough that almost the puppy can't produce enough energy or force to actually get the mucus out. And that's basically because in a pneumonia state, you're going to have liquid or fluid on the lungs, and basically it's downhill at that point. And so that's a very critical thing. What kind of cough do we have? If it's mucusy and violent, and we're hearing things and seeing things come out, and it's gross and it's nasty, that's actually a really good thing. A lot of times people will say, my dog is fine throughout the day, but we have coughing episodes during the night or in the morning. And the first question is it producing mucus? If it is, hey, we're good. We still need to monitor it and manage it, but is the danger level high? No, it's probably not. On the other hand, if we have a cough that is not producing phlegm, those are when we need to ask some serious questions and start to look deeper into energy levels and things like that. To finish the stages, we said the beginning, the middle, and the end is recovery. And so a lot of times the full cycle of an upper respiratory, depending on how bad it was and depending on the type of a puppy that you have, does it have good breathing ability or does it struggle with that? Typically the time frame for recovery is 1 to 2 weeks. And it actually takes a lot longer than what people think that they will. Life cycle and upper respiratory, I want to talk about what we can actually do when we see one of those symptoms. Before we do that, I again want to repeat, like we said in the beginning of the video, the uniqueness of the breed. Because the English Bulldog is unique, one of the biggest hurdles that you will face as a new Bulldog adopter is acquiring the correct antibiotics and finding the correct vet that has the correct body of knowledge about English Bulldogs. And so one of the things, and before I get into this, I want to preface, I'm a vet lover. I love vets. I have nothing against vets. I work with 2 of the best vets in Northern Indiana, Bulldog specialist vets that intimately understand the ins and outs of English Bulldogs. What I'm also here to tell you is there is a huge gap between a Bulldog vet expert and everyone else. And so what I see, because the breed is specifically unique over the course of the last 15 years, I have seen an approach from vets commonly that don't understand Bulldogs to treat a Bulldog with certain antibiotics on a same level as they would a Golden Retriever or a Rottweiler or any other dog. A Bulldog vet, and my 2 vets that I work with, will tell you firsthand that you cannot approach a URI with a bulldog the same way as you would with every other breed. And so the most common mistake that I see is, and we wrote it here, is with antibiotics, the most important thing is having the correct antibiotics and knowing which antibiotics do not work. So an inexperienced vet that will treat a bulldog the same as every other dog will oftentimes go to Clavamox or amoxicillin, which are both penicillin based, or a combination of the two. And so one of the red flags, if you tell your vet that you have an upper respiratory in your bulldog, and your vet gives you a Clavamox or amoxicillin combo, you absolutely know that he does not have a deep knowledge of English Bulldogs, because over the last 15 years, I have never seen a bulldog successfully recover from a severe upper respiratory with one of these two antibiotics. So that is very important to remember. You want a vet that understands bulldogs. You want a vet that understands that Clavamox and amoxicillin are not the antibiotics to use for an upper respiratory infection for a bulldog. If you have a lab, that's fine. If you have a golden retriever, it'll work. A bulldog vet expert will know that that combination does not work. So let's talk about what antibiotics do work in upper respiratory infections for bulldogs. And there are a number of antibiotics that are very effective, but my personal favorite is azithromycin, doxycycline combo. The azithromycin is great for a cough. The doxycycline is great for the upper respiratory infection. And what I like about this is there's two modes of action. And so you have two different families of antibiotics. That's always important when you're combining antibiotics, that you have two modes of actions, because there are certain bacterial strains within an upper respiratory infection that could be resistant to a particular antibiotic. And so this combination has, over the course of 10 years, has proven to be effective. It is easily accessible. Most vets, almost all of them, will have both of these antibiotics, and it is an effective means to fight URIs. Let's talk about heavy hitters. So the other antibiotics that I have used in the past that are effective but are more powerful, and so you need to be careful with using them. And I would say if you use one of these antibiotics, there should be a reason, right? If you're into a pneumonia state, I have seen Baytril or Innofox be very effective. Amikacin is very effective if you have a bacterial resistant case of a URI, and amikacin is used sparingly enough because it's expensive in the US that oftentimes it will not be resistant. Or the bacteria will not be resistant to amikacin. So that is something that we do use occasionally. And then Draxin. And Draxin is just almost a more powerful version of azithromycin. And that's the brand name is Draxin. It's pronounced tulathromycin, but we just call it Draxin. And so that is, if you do need a more powerful version of azithromycin in the same family, that could be a Draxin solution. But we'll pull back, digress. I prefer, and I always recommend, if I have an adopter that has an upper respiratory infection, what you need to tell your vet, what you need to inform them, what you need to request is azithromycin doxycycline combo, and that is the starting point, the most vital thing you can do if your puppy has an upper respiratory infection to a road to recovery. The correct antibiotics. The other thing, so we're going to talk about, so that's the first thing. Correct antibiotics is the most important aspect of upper respiratory infection, that we get the right antibiotics. And I have so many stories over the last 15 years of why the correct antibiotics are important. I have stories of vets that refuse to use anything but a Clavamox and amoxicillin. I have stories of bulldogs that have died. I have stories of adopters that have accrued thousands and thousands of dollars in 24-hour vet clinics after 7 to 10 days of a clavamox amoxicillin because the bulldog simply doesn't recover. And so a lot of times what happens with a bulldog that is on a clavamox or amoxicillin, they'll get better for maybe a couple days, and then a lot of times they'll actually take a deep dive and get worse. And so we'll get a phone call on day 7, day 8, hey Mitch, hey Erica, this bulldog is getting worse. And a lot of times it's because the original vet, in good faith, prescribed a clavamox or amoxicillin type of antibiotics, and a bulldog simply does not respond to that type of antibiotics with an upper respiratory infection. Okay, so after antibiotics, after correct antibiotics, the question is, what do we do next, right? And are a lot of different things that you can do, and that's why I have this set up here. We have our antibiotics, and I didn't actually show these, but we do actually have the clavamox, we have doxycycline, zithromycin, all the other antibiotics we have there. We have those on hand. But there is other things that you can do at home or with just a minimal amount of equipment that can help an upper respiratory infection. So I want to tap into that. I want to tap into some of the things that we do in addition at our home with a little bit of equipment and things like that. And so I would say the second thing after antibiotics is either a nebulizer. So this is the most effective mechanism, is a nebulizer with a little bit of dexamethasone, which you can get at your vet. They'll prescribe a solution. It has a steroid that is mixed into a nebulizer. And you can easily make a homemade nebulizer. You can buy one of these at the drugstore for 40, 50 bucks. All you need is a tote from Walmart. You put a hole in the side and you get a prescription for, like I said, it's usually a dexamethasone solution. And you do treatments. And so typically we do 10 to 15 minute treatments every 2 to 3 hours. And really what that does is that just breaks up congestion. That's important for anybody that has asthma. I have asthma. I grew up on one of these I've been sucking one of these since I was 4. And what that really does is it just alleviates the pressure. It opens up your airways, and it begins to break up some of that phlegm and some of that mucus. And it is a secondary road to recovery after antibiotics. So I did want to point that out. This is a great tool. Any of our bulldogs, if they come down with an upper respiratory at our home, immediately we're putting them on a treatment plan. We're going to get them on the correct antibiotics. We're going to do a treatment plan of 5-6 times a day that they're going to be in their nebulizer, opening up those airways. Secondly, if you do not have access to a nebulizer, which is understandable, you can do a steam treatment. And so one of the things we recommend to our adopters often is you have an upper respiratory, you have a shower and a small bathroom, turn the shower on, have your puppy in a crate in the bathroom, and just let steam the room for 10, 15, 20 minutes, and do that as a treatment session. And again, you can do that every couple hours. And what that does is act like the same thing as a nebulizer. It humidifies the room, breaks up mucus, and is really effective in progressing that road to recovery. So we have antibiotics, we have a nebulizer / steam room. The other thing for us that it's essential, and this is the next level, this is something that you probably don't have access to, but for us, when we have a puppy, and this is we're getting into 24-hour animal care. This is where we don't want to go. This is where you're accruing $1,000 a night to get this kind of treatment, is an oxygenator, right? And so this is a puppy warmer. And so what this does is it actually creates pure oxygen, and you can control the levels that go in, and an incubator. And so this acts as kind of like a dual form. We use this for our very, very young newborn puppies. But what you can also do is you can seal it, and you can have even a 10-week-old puppy do session treatments in here or exist in there for a certain amount of time, and you have pure oxygen. And what that does is that really helps having that oxygen in a sealed area, really helps the puppy breathe and things like that. And that really is to the point where you are in a pneumonia state, right? So if we get a call and we've already made mistakes in the past, right? We go to those stages, okay? We either didn't do a treatment, we didn't catch those first initial stages of a light mucus or a light cough, and we've already progressed to the point that we have liquid on the lungs, we have fluid on the lungs, we have a pneumonia state. This is the type of tool that quite possibly might be needed. And so if we go backwards, that is why correct antibiotics is so essential. You don't want to get to the point where you need oxygen. You don't want to get to the point where you need a 24-hour vet clinic. And that's why when we talk about this kind of teeter-totter of risk, it is essential for a bulldog to be on a antibiotic like a doxycycline or azithromycin, or it is very likely or could be likely that they will end up getting worse, that they will end up going to a 24-hour vet clinic and things like that. And so that's why I wanted to make this video. That's why I wanted to put the information out there, because there's a critical decision that needs to be made at the very beginning stages of upper respiratory that can save you from spending thousands of dollars or having the heartache of a sick puppy or even death. I've seen all those bad things happen where an adopter is led to believe that they can go on a lower level antibiotic and bad things happen. And so hopefully this information can help you in the future. Number one, correctly identify what an upper respiratory infection looks like so you can take action quickly. And then number two, be able to implement a recovery plan that involves the correct antibiotics, that hopefully involves some kind of humidifier, steam room, nebulizer, and so we can save you from having to have a 24-hour vet clinic have your puppy on oxygen. And that is all I have for you guys today. Say goodbye, Root Beer. Goodbye.